I want to ask you, Senator Paul, what do you think that President-elect Trump should do with regards to the timing of repealing Obamacare?
I think we should vote on replacement the same day we vote on repeal. I discussed it with him the other night. I think he's in agreement. We ought to vote on replacement exact same time. And I think the replacement doesn't have to be too complicated, but it should try to insure more people at a lesser cost. Obamacare kind of failed us because the prices went up, and actually we didn't necessarily insure more people, and many of the insurance companies are actually going bankrupt.
But Senator, a lot of Republicans within your own party are saying that perhaps they would have to delay the implementation of an alternative. Why is that politically bad, and why is it also policy bad?
Well, one, Obamacare is failing. Let's say North Carolina Blue Cross lost $400 million last year in the individual market because of the Obamacare rules. If you get rid of the individual mandate, which we're going to do, it's going to get worse even quicker. But the model we have under Obamacare is not working. You've got chaos. You should have replacement day one, because we've got to replace something really bad with something that allows the marketplace to work. And our replacement bill, I think, will get to the heart of this. We're going to legalize inexpensive insurance. We're going to help people save for that insurance. And then we're going to also help people who are in the individual market band together to be part of a group or an association so they can get cheaper rates.
There are popular parts of the Affordable Care Act. As you know, millennials being able to stay on their parents' health care plans until they're 26, just to name a few. But you did mention that it is largely unpopular. Is there any parts of Obamacare that you think should remain intact in the Trump administration?
I think the goal of Obamacare was to insure people, to insure more people, and we should keep the goal. Most of the practicalities of what was in the bill didn't work, and they started out with some suppositions that are just contrary to each other. One, that you can wait to buy your insurance till you get sick. That doesn't work as an insurance model, and it leads to bankruptcy of the insurance companies.
Politically, though, if you do repeal this, you look at the polls, a huge contingency of Republicans think this is unpopular, but heading into a midterm cycle, a lot of Democrats are already organizing and saying that this would be a way to campaign to get it back. What do you say to Republicans who are concerned that this would hurt chances in 2018?
That's why you have to immediately replace it. You replace it with inexpensive insurance, help people to save, and help individuals to band together so they can get a cheaper price.
Senator, I know you're busy. I just have one more question for you. And of course, earlier last week, actually, you reintroduced legislation to audit the Federal Reserve. Did you talk with President-elect Trump about that? And do you anticipate that he will ask Federal Reserve Chairwoman Janet Yellen to step down?
Well, Donald Trump on the campaign trail said that he was for Audit the Fed. We did not specifically talk about it in our conversation, but Audit the Fed is very popular and very bipartisan. The last time it passed the House, every Republican and 100 Democrats voted for it. It's about transparency. It's about you knowing what your government is doing. And under the Constitution, Congress gave some power to the Federal Reserve, but they didn't give away everything. We should be overseeing what they do there, and it's a real problem that the main people up here arguing against oversight of the Fed is the Fed themselves.
And do you think he'll keep yelling?
I don't know about that, but I do know that Audit the Fed's a good idea, and we're going to propose it again. And with Donald Trump's support, I think we have a pretty good chance of passing it.